Welcome to CDP's podcast, Practical for Your Practice,
where we give you actionable intel to support what you do, one colleague to another.
Welcome back to Practical for Your Practice podcast. I am Jenna Ermold, here today with the one, the only Dr. Kevin Holloway.
The one and only, huh?
Yeah.
Wow.
As far as you know, I don't know. Do you know more Kevin Holloways?
Well, believe it or not, there are some out there, and we could go on a whole episode about all the crazy
Wow.
Kevin Holloways I've come across. But there is even a psychologist, Kevin Holloway, in a university in London somewhere. And so I'm not even the only Kevin Holloway psychologist. So
that's sad. I'm going to go out on a limb and say I am the only Jenna Ermold psychologist.
The one and only.
Yeah, one and only.
Yeah.
Speaking of one and only, we have a guest today that I have actually sort of maybe stalked on some podcasts because I went from one to another because I really was enjoying what I was hearing. And so I'm really thrilled that he agreed to join us today. This is a topic we, in all of our time, have not covered, which has really been a blind spot, something that we should have paid more attention to and included. And hopefully this means that you will now include this in things you talk to about with your military connected clients. But I'd love to welcome Dr. Shane Kraus. Please welcome to Practical for Your Practice.
Welcome.
Thank you very much. Thanks for having me.
And we always kind of kick things off by actually letting you give a thumbnail sketch of who you are and what you're focused on. So what are we going to talk about today?
Okay, so my name is Shane Kraus, and I'm an associate professor here at UNLV and University of Nevada, Las Vegas, and psychology. And I have a behavioral addictions lab, so we study actual behavioral addictions, like the name says. And one of those big things is gambling. So we look at gambling disorder. We also look at other, behavioral issues and substance use. But today we're going to talk about gambling, and I've done a lot of research on gambling in veterans as well as some active duty, and I've been doing that. Oh gosh, Rudy's maybe a decade now.
Fascinating.
And we just finished a 3-year project with, looking at gambling disorder in active duty as well as in veterans that we could talk about as well.
Amazing.
So immediately my brain goes to gambling disorder. I'm thinking of casinos, right? I'm thinking of like kind of the main hubs of gambling, but I'm guessing it's a little wider than that, and maybe includes other kinds of settings or contexts or whatever the gambling may be happening. Can you tell us a little bit about just generally how wide that goes?
Sure, yeah. So, I'm in Vegas, right? So everyone knows Vegas often for many reasons, right?
Yep.
And casino gambling is one of them, right? So gambling has really changed a lot, right? So casino gambling's been around for, gosh, Rudy's, 70, 80 years, more than that. But gambling's really gone to online now. There's sports betting, if you probably heard about. There's Holloway market, which they're saying isn't gambling, but really is gambling. So gambling's all over. It's now, for 40 of the 50 states as well. We're going to talk about the slot machines on military bases later on today as well. So it's been around for a long time. It's in our culture. Lotteries are, it's just a cultural thing that we're experiencing, but it's increasing everywhere, and that poses risk for people as well.
Yeah.
And kind of talking about that risk, I think, again, given that, it's taken us so long to incorporate an episode on this, what is a gambling disorder? So for our audience, what would sort of help folks determine what is sort of just this, little pastime thing that happens from time to time versus something that requires clinical attention?
Yeah, so really quick cliff notes here. So in 2013, the DSM-5 came out, the Diagnostic Statistical Manual, right, of mental health disorders. And prior to that, gambling was called pathological gambling, and that was in a sense what, you could diagnose someone, and that was reclassified to gambling disorder, which became the first in the US behavioral addiction. So what it's an addiction, it's not a substance, unlike other, ingesting a substance, it's a behavior. So what is gambling disorder? It's really not just frequency of how much you gamble. There are people who gamble frequently, a couple times a week, or buy lotteries, once a week. But it's really about kind of this loss of control. So what gambling disorder is when someone's lost the ability to control their gambling. They're gambling despite having harms or problems in their life. They're chasing losses, they're losing and they keep losing more. They're having a lot of functional, mental health issues, family issues because of their gambling. So in a sense, gambling's taken over their life, and it's kind of number one in their life, and it's really causing havoc, I would say. And that's really what gambling disorder looks like clinically.
That sounds like a lot of overlap with how we often conceptualize other addictions too, right? It's not just a frequency thing, but
Yeah.
it's kind of like this inability to
Hmm.
control or inability to cut down even when trying to, and that
Hmm.
it's causing harm despite the use. Those similar things you were just ticking off.
Yeah, absolutely. It's very, this is why it's an addiction, right? It has some of those very similar overlaps. I think what makes gambling slightly different is that, you don't buy cocaine to win more cocaine, right? So gambling is where people
Right.
gamble to often, win money, cover their losses. So it's really, really, a unique aspects of it. The other thing that's really fascinating, I think, too, is the amount of you gamble. So I've treated a lot of substance use. Most people have a set amount of alcohol they drink. And, if they go over their alcohol, cocaine, substance, they could have overdose.
Right.
There's only so much cocaine celebrities can do, right? Before there's
Right.
consequences, right? But for gambling, you could start at, the nickel slot machine and you could be at a $50 slot machine a pull, right? The amount of money you can gamble increases. This is part of the illness. And
Mhm.
it really just goes, through the roof. I mean, you could be gambling $1 million a day, right?
No
And there are
limits.
people who've done that versus someone's not going to have a $100,000 cocaine habit a day, right? So there's limits, but with gambling, there is no limit. You can keep increasing, and that's what happens. That's part of the problem.
It occurs to me too, because this fascinates me. It occurs to me too that maybe different than substances, kind of the payoff schedule is a little bit different. Like we all hear about intermittent reinforcement schedules and how just involved they are. I imagine I haven't done nearly as much work with substance abuse, perhaps as you have, and I imagine with substances, it's almost like this diminishing returns, right? There's
Hmm.
kind of tolerance built up, and that,
Correct.
but it's not. But there's some kind of result every time. Whereas with
Hmm.
gambling, you get that intermittent reinforcement every once in a while. That seems to be even
Hmm.
more strong,
Yeah.
pulling people into the patterns.
Yeah, and that's kind of part of the brain stuff. So we think about the
Yeah, yeah.
neurobiology, right? So we think about the near misses. So if you're on a slot machine, for example, and it says, you have the fruits, it's almost, and you have the two or three line up, and then the last one's just off. The set last seven is off, right? But so for someone who has a problem gambling, right, a compulsive or problematic gambler, their brain really, they love the near misses. That's really, so you might
Mm.
go, if you don't have a gambling issue, oh, I lost, and you have the opposite, like, oh, dread. Their brain goes, ooh, you almost won. So it's the
Wow.
near misses is what reinforces it, because our brains get bored really easy behaviorally, right? So most people's attention span, particularly with teenagers and young people on social media, they got about 10-minute, we're lucky, attention span now. Attention spans are short. So for gambling, you have to be constant. You have to have these near misses. You have to be changing up quite a bit, right? That's what makes
Yeah.
it exciting. That's what reinforces it.
Hmm. That is really and it's, a really good episode for Kevin when he gets to talk about reinforcement schedules. So you just kinda made
Which
his
I
day.
just got reinforced
He
all over the
got
place.
yeah, he
Yeah.
just got to dork out and nobody's getting it with no consequences. So, that is fabulous. So I do wanna kinda zero in a little bit
Mhm.
on military culture
Yeah.
and the
Yeah, let's do
military
that.
because
Okay.
as Kevin will now out me, I'm a military culture dork.
Hmm.
Um, what maybe is unique in terms of the
Okay.
context of the
Yeah.
military, things about the culture that, reinforce
Hmm.
gambling or, things that get in the way of
Hmm.
somebody coming forward when they have a problem.
Yeah, so I would say, we've been doing a lot of research on this area, and I would say that, kind of give a caveat, right? We don't so far and we've been doing interviewing and research. I'm not sure that the military causes someone to have a gambling disorder, but I think there's risk factors, right? So one of them is, unfortunately, we have a number of our those who've served have had come in from childhood traumas or challenging circumstances, or them had family histories of gambling, and those are risk factors, and they're risk factors for all people. But when you put people who've been deployed, who've been separated, who are in highly stressful positions,
Mm,
gambling often can become a coping or escapism, right? And one of the challenges that we have so we'll talk about, overseas, they have slot machines on bases, right? Which is illegal in the
mhm,
US. In Vegas, you don't have to go very far from the base to get access to, slot machines. But because I think that becomes a way to deal with boredom, you're overseas, you're deployed, you can't do much. So I think gambling becomes this kind of traditional like behavior that people do culturally. It's often done with other people, with cards or with gambling. And I think that sometimes for some people becomes coping and kind of comes into stress. There's also this idea that gambling is very normative. It's part of the culture, which again, doesn't always mean it's a problem. The issue is that if you have a problem, our work has shown that you'll say nothing. And because if you say something, you will be penalized immediately for, if you have, if you're
Yeah.
active duty, your ability to lose your clearance is a real issue. We know this from our work. So why would you disclose a problem, right? And the issue with that is that gambling is often a slow process. It doesn't just happen overnight. You have an issue. But if we can't intervene early for active duty, we have a problem. If they're going to stay buttoned up on an issue for years, well, that's only going to increase the probability of more issues down the road. And that's what's
Did-
happening, right? It's that culture of not discussing gambling. If you have a problem, it's really you who has a problem, not the culture. But again, our work has shown that, yeah, some of these risks being deployed away from your family, some places you can't drink, you can't leave the bases, but you can gamble. Well, I don't know that's necessarily a great activity for people. Without educating, hey,
Right.
just remember this is a risk. This could actually, set a limit and all these things. But there isn't really education happening on gambling on the military basis at all. So
And that's even just talking about, access things like
yeah,
slot machines. But
yeah.
to your point about, kind of the um
Right.
what is the word?
Apps and getting
Mhm.
Apps and
online.
Oh
the
yeah,
online
absolutely.
gambling,
Yeah, yeah,
all that downtime and
yeah,
boredom. And I have
yeah,
this, extra appendage called a smartphone that can
yeah,
do all these things for
yeah,
me. I
yeah.
feel like
Yeah.
that's another
Well,
huge
well,
risk
that's
factor.
I think of that. So our military has the best technology in the world. We know this, right? In terms of everything. And so those serving really are no technology. They're not good at, they know smartphones, they know everything. And so they just have that knowledge. And you're right. And our own data, our own papers, we have something under review now that really shows that they're more likely to do sports betting. They're more likely,
Mm.
our active duty probably are very high users of social media or, lots of content, right? So betting and online stuff. And I think that's a concern now that we're thinking about polymarket. There's lots of controversy. We're thinking about
Right.
polymarket and online risks. So, yeah. So, yeah.
Well, so that drives me to another question that I
Hmm.
kind of have too, and that is,
Sure.
I wonder, what number one, like, how common is this, right, in the general population, but also how common is it in the military? And maybe a follow-up to that is, are there like variables that make somebody more susceptible or more likely to have problematic gambling or gambling disorder? Whether that's socioeconomic status variables, whether that is, particular characteristics or, genetics for that matter. We see
Hmm.
that with
Sure.
substances too. Like, so, I mean, it's kind of a
Hmm.
two-parter, and I apologize for
Yeah.
that. But
Okay.
like, generally, like, how often are we seeing this,
Okay.
and what makes somebody more susceptible?
Okay, so we'll do the first one. So we know that gambling itself is very prevalent, right? So 70-80% population does, some time of gambling. Often it's a lottery, things like that. So we know that sports betting online apps are going up. I don't have exact, we've been publishing it, but every year the data changes, but I'd say, 15, 20% now of young people. Our data, the paper hopefully soon will be published. We found among active duty compared to veterans, compared to civilians, active duty was 80% are using mobile online sports
Mm.
betting. So I want that to be published. And when that is, I think DoD will probably hopefully call the lab for a phone call. So I think that is something to consider. And again, these are young. It's not that surprising.
Right.
They're young people. They're smart. They know technology. I get
With a
it.
regular paycheck coming in.
Yeah, they're not,
Benefits.
settled down with lots of bills and debt. And as a young person myself who made very many poor financial choices and for like until I was in my mid 20s, I get it. I think so that's an issue. I think so. I think sports betting is increasing. I think what do we know across populations? We know that there's veterans have higher problems than civilians. Okay. And then among active duty, we think it's increased. The issue is there's so little data on that. We have some of
Right.
the few.
Yeah.
So it's a really hard population to get access to. The military has sponsored, a couple studies that were not well done where they have, a screening tool that's poorly implemented, but then they don't actually keep it anonymous. So why would you
Right.
actually
Nobody's going to
say you
endorse
have a
it.
problem? I mean, it
Right.
was,
Yeah.
but then they say we don't have a problem because no one said they had a problem. It's like, well, who would say they have a problem? I
Right.
mean, it's just, just terrible. So that's the first one. So what are the risk factors? So again, family history, I think, there's a genetic component to
Mm.
some degree. I think trauma is a big one. So childhood trauma, mental health issues, PTSD, we published pretty extensively on this. People with PTSD, why? Because they often turn to gambling for coping. Well, this is the same way people who have PTSD. I was in the VA before. I'm a psychologist. I, PTSD trained and all that stuff and done a lot of trauma treatment. People with trauma go into a drink. They also use alcohol and drugs. They use pornography. They
Yeah.
engage in high risk sexual behaviors. And guess what? They also struggle with gambling. Not that surprising. So,
Mm,
so we see those relationships. So I think it's a lot of those factors. I think for younger people, it's impulsivity, just sensation seeking, just kind of having access to money, things like that. So, these are risk factors. But what we don't see happening is education and knowledge. Like a lot,
Mm,
little knowledge goes a long way. If I can tell you, hey, think about your money, here's some strategies, and also let people know, like, hey, these apps that you're using, they're just all they want to do is manipulate and take your money. Like they don't care about you. They're using AI to create these algorithms to, exploit you. And I think
yep.
when people are more informed about that, because what the problem right now with gambling and even with I think with veterans is that people who do sports betting, for example, if they used to play sports, they think they know sports really well. Well, your knowledge and how well you do don't really match up. And we know this from our own research. So what happens is they exploit your feeling that you're a really good better. Oh, I know a lot about sports.
Yeah.
And they
Yeah.
use that to push parlays, prop bets, and these things, which is where people always lose, right? And that's where they make
right.
money, right? Yeah.
And I wanna ask you to do the banana analogy, but before
Sure.
that, how much money are we talking? Because that was stunning to me when I heard some of those figures
Yeah,
about.
so I'm trying to think for the military, it was, oh my gosh, a couple $100 million in revenue alone. And this is, these are not a lot of active duty people. These are on bases, so it's a lot of money. And that's the revenue. So that isn't actual, that's the winnings or the what they kept. So I guarantee you, it has to be, 500 million probably being actually wagered itself. It's a lot. And that's not the online
Mhm.
stuff. It's a lot of money. It's remarkable for the military, but then it's remarkable for the country where we're talking about billions and billions and billions of dollars, probably 100 billion at least,
I
which
had
is
somebody
insane.
very wise at one point said, if you ever delude yourself into thinking you're going to win a lot of money gambling, just drive down the strip in Las Vegas and
Yeah.
see where did all that money go? Not into the
Yeah.
gambler's pockets, right?
Yeah. And I think it goes back to, I think like I'm in Vegas. I love being here. We have, I think, the best restaurants in the world. Food's expensive, go to a really fancy restaurant.
Everything's
It's really
expensive in
good.
Vegas.
It is, but the food, but you also have some of the best chefs in the world, so it's
Yeah,
okay.
true, true.
But I remember I went to years ago, we went to a restaurant for our anniversary and it was Italian. It's a really great restaurant. And they actually I didn't realize they fly the fish in every day fresh from
Oh my
Italy.
gosh.
It's fancy and it was very expensive, but I mean I've been to Italy, it was very good.
Yeah.
Well, I didn't, when you pay an expensive meal, you don't expect to not pay that. So with gambling, the problem is people, when they lose money, if they spend $200 gambling and they say they fun, they want that money back. And I think that's the problem is that you put $40 or $20 on a sports betting game and you have fun and it's with a bunch of people and it's a competition and
Yeah.
it's all fun, so what? But the issue is people see it as making money, and young people, particularly young men, particularly, are thinking that this is the way to make money, like crypto, poly market, all of this
Right.
is being targeted towards them, and this is how you're making money, and this is not how you're making money. This is how you're losing your money. I guarantee you're losing your
Absolutely.
money,
This is
right?
not a good investment
It's
plan.
not a good investment, but they're framed as though it's a good
Right.
investment because of how the apps work, right? How technology works. Yeah.
So when you were talking about education, education with clients go a long way, but we're hoping to educate providers too. And this is why I kind of want you to get to the
Sure.
banana,
Yeah.
whatever, because I
Yeah.
think it will help us think about what tires do I need to kick.
Yeah.
When I
Yeah.
hear this, what makes me then ask about gambling in a way that I might not get the same response as a survey,
Mhm.
um, you know,
Yeah.
distributed in
Yeah.
another.
So I always like to say, I do this a lot of my trainings, is that like gambling's like a banana, right? So it comes in bunches. So what that means is that if I'm treating, so comorbidity is 80% or more people with gambling disorders have comorbid psychiatric disorders, depression, anxiety, alcohol is probably about 25%.
That's
Veterans, it's probably
huge.
30 to 40% have
My
PTSD. So
goodness.
if we have lots of mental health issues, if you're seeing anyone with those issues, depression, anxiety, PTSD, particularly military populations, you should be screening for gambling because the chances are you're more likely to catch it when you're screening, right, for these other
Right.
issues. So it's really on you. You're not generally treating just one issue. Remember, gambling, so when we think about longitudinally, so we do research where they follow someone for years and it's a chicken or egg. What comes first? Is it mental health issues, then they get a gambling problem, or they have gambling and they become depressed? What we know is actually they have mental health issues and then they gamble, right? That's extremely the order. And that, and we need more research on that particularly with veterans. But the reality is mental health issues increase, stress increases, and gambling develops as secondary. And so if you're treating all these other issues, you really should be screening for gambling. But today for younger people, it's sports betting, it's online wagering, it's all those things because the markets they're aggressive. I mean, they're spending, I just did a podcast a couple months ago with someone, the gaming commissioner of Michigan, and he said that the market spent $1 billion in the state of Michigan in 1 year for ads
Wow.
before they launched online in sports betting in Michigan. $1
Oof.
billion. Think of that
Wow.
in ads. Like that's, we think about political campaigns. We're like, oh my gosh, how much on mailers and all that. But
Right.
for one state of Michigan, they spent $1 billion in ads and aggressive marketing before it went live. That Michigan, I used to live in Michigan, Ann Arbor. It's a great place. It's a big, cool, amazing place. $1 billion is a lot of ad money, right? And that
Yeah.
just tells you how much money they expect to recoup. Well, they're spending that kind of money everywhere in the country, and they're targeting, likely, for clinicians, they're targeting your patients. Every person you're seeing is probably being targeted. If they're older now, they're being targeted. Polymarket has, you know, funny videos. I mean, you watch their videos, they look really funny. Seniors, doing crazy stuff, jet skiing and it being crazy. And I think they have a senior, going through on a jet ski on fire through fire, in his Polymarket. Why? Because seniors have access to cash and they want money, right? And
Right.
that's
Right.
exploitation, right? And this is a reality. So the idea that, well, my person I see doesn't go to a casino revenues are flat. All the revenue is going online now.
Yeah.
And so, but
And
I
we
was
don't
at
ask about that. That's not the question we're asking, if
yeah,
we're
I,
even asking.
I was at a game recently. I was just went and saw a Lady Aces game, which is great here, and they did well. They won, which is awesome.
Nice.
And there was a couple older adults in front of me, and they all were playing Candy Crush, and they all had different games, and some of them were very gambling-like games.
Mhm.
And I think it's not surprising that some of that might lead eventually to gambling or online gambling, apps as well, right? So we got to be careful. We got to be screening everyone.
For sure. Well, you mentioned too, like lots of comorbidities that go along with that. I wonder too, and one of the things that occurs to me too, and not that this is a diagnostic entity in and of itself, but people with suicide risk.
Yeah.
Um,
Yeah.
Can you tell us a little bit about the relationship there?
Yeah, so I think pretty consistently, there's some other psychiatric disorders that might be slightly higher, like bipolar with psychosis is pretty high. Eating disorder has higher suicide, but gambling disorder has very high suicide attempts and as well as suicidal ideation. We've done work here. We did a study in Nevada and around the country, and I think we found 35% we did a study. Had over 600 people in it. I think 60% were women. I mean, just really cool sample of people struggling, unfortunately. And I think a third were actively suicidal. I mean, that's a
Oh
good
my
example.
goodness.
From the veteran perspective, it's very, very high. We looked at Cleveland's data. We just published a paper. It's in Military Medicine recently. And we found, I think, women veterans had the highest, I think, suicide. I think 40% attempted suicide who had gambling, and I think men was
Wow.
about 30%. So if
Wow.
someone has a diagnosable, mental gambling disorder and they're a veteran, the risk for these are attempts, not just having active suicide ideation, are very
Yeah.
hard. Yeah, it's exceptionally high, and it makes
Wow.
sense. It makes sense because you imagine if you had spent $300,000-$400,000, I'll give you an example. When I was in Massachusetts, one of the clients, a veteran I received, had was very successful and married, and his child was going off to college, and they had a college savings account. So he never touched anything. But when they went to go to BU or wherever it was in Boston, and to pull the 100,000 plus, so the 150 ready for that account, start paying that tuition, well, it was all gone. And of course this person attempted suicide. They were
My
not
gosh.
successful, thank goodness. I got them and we treated them, but they never touched the military, all the retirement. They had 401ks, nothing was ever touched, but that one account he had access to it and he spent it all, and he always thought he would win it back. And so this is example, imagine the shame and how much frustration that veteran had, who now had spent all that
Absolutely.
college. Yeah, and it was a really challenging case. It was a good outcome, but that's the reality of that. They can look successful, you pay your bills, but you have hidden credit cards, you have hidden debts elsewhere. Yeah.
Well, it makes sense when many of the different theories about suicidality and suicide risk, right? We got all the elements there, right?
Mm-hmm.
Hopelessness, worthlessness,
Absolutely.
perceived
Yep.
burdensomeness. I mean, of
Mm-hmm.
course, it makes sense that that would
Yeah.
overlap
Yeah.
quite a
And
bit.
some people think that's the solution, right? Of course, that's not the solution,
Right.
obviously. But it's a challenge. I mean, I think like we go to, occasionally once, twice a year, we'll go to local, we have a big liquor store here and we get, a couple bottles of wine or, if we're going to have a party or something. And when I walk in, they don't have discounts. They don't say, here's a BOGO, here's $200 free credit for, for buying wine. If they did that, I think the world would, probably even Vegas would probably,
Right.
Vegas would have issues, right? Like the state who regulates alcohol would lose their mind, right? But for gambling, we do that. And we have the free
Yeah.
quote free play. You have
Yeah.
online casinos or creditors giving free, giving low risk to credit and loans and micro loans and all these things that don't exist. And so, the local
Mm.
drug dealer, whatever you want to call it, doesn't give you a micro loan or, a thousand
Right.
dollar credit, line. It doesn't happen, right? But for gambling, it does. And these are the risk factors of why people get themselves in financial shape, really bad areas. And then of course they feel like they have to kill themselves, which is really sad and tragic, right? And that's what that's why we should always be screening for gambling, even among, veterans. And even I don't know if it's been implemented, but I've recommended it for the veteran suicide crisis line. We have the option for
Right.
veterans. They should also be screening when veterans are calling for suicide about gambling, because my gut
Yeah.
feeling is it's there. I don't think they've implemented that, but it should be a mandatory question, actually, because I think that is going to be a portion of those individuals as well.
And especially in that context, if somebody's asking the question and
Uh-huh.
opening the door to talk
Uh-huh.
about it in that context, I feel like it would pick up
Yeah.
a lot. So
Yeah.
let's say we do ask the good question. We actually
Mhm.
talk to somebody and they say, yes, doc, I think I have some problems here. What do we do with that? What are our evidence-based
Sure.
options for gambling?
Yeah, so I think it's like we think about substance use. So I'll use kind of parallels because they're similar. So one of it is great. I think it's great. I'm happy that someone would acknowledge, their concern. So obviously, figure out screen a little bit more, ask more about, and then figure out whether are they more interested in harm reduction? So we're gonna help them cut back, spend less. Sometimes they'll say, I don't want to quit. And I say, well, how about we try to cut back? I'll say,
Mm,
okay, Mr. Johnson, we're going to try to cut back for 2 weeks, but I'll make a deal with you. We'll try this, but if it doesn't work, what's the alternative? And they'll say, okay, abstinence. Okay, great. Sometimes we do that first, right? So that we don't, if there's ambivalence, right, from a motivational interviewing
mhm,
perspective, we'll try to meet them where they at. And often people with gambling don't want to stop because they think, well, I got to win my way out of this financial hole that I'm in,
Right.
right? And they'll never will. And if that we try that harm reduction, if that doesn't work, we often do really cognitive behavioral therapy has been shown to be very effective. About 70% of people who do CBT respond very well to it. And again, it's focused on the classic things like we think about addiction, places, situations, thoughts, feelings, behaviors, right? What's unique about gambling that we haven't talked about is that gambling has cognitive distortions that are unique to gambling around luck,
Mm.
tradition. So like I worked with someone a while ago who was a lottery player, and they always played the grandma's birthday, their daughter's birthday, and they had all these numbers that were like family birthday numbers, and those were their lucky numbers. And they just struggled because, well, this is luck, this is, what I've always done. And there's no such thing, right? The lottery is random numbers, right? And
Sure.
so there's these cognitive distortions, like, well, if I do this, if the machine hasn't one for a while, it's going to pay, right? There's these beliefs that are really what we call cognitive distortions or fallacies and mistakes. And those you have to address because you don't really have that with cannabis or alcohol. Like you might have expectancies. People want to drink to feel better or to sleep or whatever. But people don't think, well, I'm going to wear special socks so when I drink my Bud Light, I sleep even deeper,
right,
right? There's no alternative, right? It's like people drink because they're stressed. They want to help their
right.
PTSD. But gamblers, oh, I have to do this and this because then this happens. And those are, you got to tackle that in treatment and CBT. But it's pretty much like cognitive behavioral therapies works really well. There's no evidence-based medication for gambling. In
Uh-huh.
terms,
Okay.
we've written on and published on naltrexone, which is a medication opioid antagonist for opioids, alcohol. If someone has comorbid substance use, I'm a big fan of naltrexone. I like it. It works well, particularly at lower doses, like 50 milligrams. will use that, and that's very good for craving, for reducing urges and cravings. But that's probably 5% of the cases. So it's really
Mm,
for the most severe. But if someone's struggling with problem drinking or heavy drinking and they have a gambling issue, which
right.
again is about 25%, gosh, Rudy's, we're gonna go for
Yeah.
naltrexone because
Yeah.
that's gonna kind of get a double impact. So yeah, treatment works, but also, Gamblers Anonymous, family support. I think our biggest thing when we think about our veterans, so active duty or young, they often have partners, they haven't burnt every bridge yet. Our veterans or older folks have burnt every bridge you can think of,
Yeah.
sometimes three, four times.
Yeah.
So our job is to help them build the social relationships, the connections, get them engaged in the community and their faith communities, wherever they need to be.
Right.
And that's really helpful for gambling because people often are gambling in isolation alone, by themselves. And that's not going to help. So we want to get them involved with other people. We want to get them engaged with other people. We want to help them rebuild relationships, right? And then once we do that, the gambling becomes less important, obviously, right?
Huh.
Yeah.
I'm just looking at this is such a fantastic discussion. I'm learning
Yeah.
a whole bunch a whole bunch of things that I should have been asking about all along that I'm gonna certainly implement some changes a bit. But just kind of looking at the time we have, I
Sure.
wonder if we can introduce, again, our theme for the season is that, the moments that changed us or those impactful moments. And, it occurs to us that all of us have those stories in our history, whether it's our career, our professional career, or other areas of our life where we've had that experience that was, something that changed our perspective. It was kind of maybe an aha moment or just really solidified why it is we do what we do. And I wonder if you would share yours with
Sure.
us.
Yeah, so I, my PhD was in Ohio and Bowling Green State University in clinical, and I do addictions, and I went to Yale for my postdoc, which was great, and worked at the VA as well there for like kind of a dual fellowship. And I did behavioral addictions, right? So my big thing early in the VA was actually doing the first like study on compulsive sexual behavior, pornography issues in veterans, combat veterans. We wrote those first papers, and I really argued I didn't want to do gambling. So one of my mentors, I had two of them, Steve Martino, who's phenomenal, and
Yeah.
Mark Potenza, who's well known as well for gambling. And Mark was always like, "Oh, do gambling," and I said, "No, I don't want to do gambling." And so when I moved to Massachusetts to be in the Visit One Myrick, I started a behavioral addictions clinic. It's still going at the Bedford VA. And one of the first cases I got was a gambling case. And I thought, well, this is interesting. And it was actually someone for sports betting, actually. And it was like someone who went to the residential program in Cleveland, and it was a really cool case. But then I kept getting referrals, and I think, well, no, I'm trying to do PTSD and pornography and PTSD and alcohol, behavioral things. And I kept getting all these gambling cases. And I remember talking to my old, mentor, and he's like, well, this is because gambling matters. And then I started writing some of my first papers. And what I realized is that there was a lot of gambling issues, but no one was asking about it and talking about it. And for
Yeah.
me, I realized like, and then because people say, "Oh, you shouldn't study that." For me, my career, I've been successful, but people will say, "Oh, that behavioral stuff's not real. You should study this." And I'm told not to do something, that means I should do it. That's just like,
You're
so
our kind of person.
I
Yep.
am, but as a parent though, sometimes when my child does that, I'm struggling with that. But so in a sense, the behavioral stuff, the addictions camp and the gambling, we started doing it and just started doing, and then we did a study in primary care and we screened, and oh my gosh, we found multiple veterans and no one knew had a gambling problem, and all were suicidal, and it was pretty,
Well,
and the primary care nursing staff says, oh my gosh, we have to screen. This is how we find suicide. And I said, yes, because
Mm,
these are veterans who had, 70,
wow.
$80,000. No one knew they had the debt, and they
yep.
were wanting to kill themselves, and they just didn't. But once we asked about gambling, suddenly they talked about it. So I think it's one of those things that I think if you make space for something, people will surprise you and talk about
Yes.
it. And I think gambling is one of those things. I think veterans are hired because they have lots of these complexities. And I think it isn't just because they've been in the service, but sometimes service is where they started the habits of gambling. And then when they came out, they just can't break the habit. And then
Yeah.
stress and divorce and all these PTSD, they all snowballed. So for me, it's become an issue. And then, a big thing. And then, like I said, we just finished a 3-year study where we went and we've been publishing on the data from the Cleveland VA, and we
Mm,
found lots of trends and psychiatric problems, and we've been publishing. But then we also interviewed 28 service members and veterans about their lived experiences, and we've been publishing that. And it's just surprising of how many have had this issue for a long time and told no one. None of them were in
Yeah.
VA. No one told the service members didn't tell their commanding officers, of course, and all veterans were not in VA. They refused to go to VA. And it's really just shows you that it's a real issue, but no one's making a point for it or space for it. And for me, that's what I live for. If no one's doing it or it needs to be done, I'm going to do it, because that's, to me, I find interesting. I don't want to ever do research that lots of people have done before. I find that very
Sure,
boring.
yeah.
So yeah, so it's been really successful. And like I said, I have my concerns moving forward is really with polymarket, with gambling, sports betting, with active duty, because I do think it promotes, there's vulnerabilities there for our military as well. And also,
Yeah.
these companies are exploiting young people like on a high level as well. So yeah,
Oh,
so that's kind of my backstory. Yeah.
So well, first of all, I absolutely love that you wound up moving toward this because you
yeah.
were initially trying to avoid it, and it just kept coming back to you. You just couldn't escape it. And certainly we are really glad that you leaned into it because your contributions have been fantastic.
Agreed.
For folks who are tuning in and you've really kind of sparked their interest and they want to learn more and they want to grow those skills to
Mhm.
ask the good questions and
Mhm.
kind of shape some of their skills to be able to treat things, like what would be some good, what we call actionable intel? What would
Yeah.
be some
Yeah.
things that you
Okay.
could tell folks,
Yeah.
resources or like
Mhm.
specific tips to change their practice tomorrow?
Incoming actionable intel.
Yeah, so one is checking out, I think, so looking at your local state. So VA is doing trainings. I think I've done a bunch of trainings for VA. So if you're in the VA or DoD, look for training opportunities. If you're, depending on what state you live in, also look at the council. So generally, each state has like we have the Nevada Council, it does problem gambling. I just did a state training for the whole state, like last week actually. There's lots of those out there to give you tools and resources. You can also, like for me, email me, for example, and I'll send you screening tools. And there's a lot out there. I think it's a growing issue. What I would say is that I think you don't have to be an expert in gambling to treat gambling, because you're already treating all the other stuff in the banana, right?
Mhm.
But do you have to spend a little time to kind of, like, your first couple cases, understand, well, cognitions and like
Right.
fallacies around like lottery or sports betting, or yeah, there's some weird, odd stuff, and also the cultural
Nuances. Yeah.
components of what happens when someone, has gambled while they're in the military, and even now they're out and they're a civilian and they're a veteran, but the poker is part of their brotherhood and their team.
Mm,
They
Yep.
have a
Yep.
problem. That's a
right.
real issue. So how do we have that conversation? So I would say look for there are different resources. There's the national, what is it, the National Center for Problem Gambling, as an NCPG, as an organization, has annual conferences. But I would encourage you to try to go to those things. Try to do your state. Every state generally has a gambling conference, maybe. Try to go to those things and educate yourself, because I
Sure.
think it's something that I guarantee you will be treating. And for sports betting, looking for like the free trainings, online stuff. There's quite a bit out there. I think, like, a lot of myself and others are doing them for different organizations, because this is something that you will absolutely be treating. I promise you,
Yeah.
as a clinician, because it's becoming, I think, a pretty big issue right now. So yeah.
It sounds like one thing I've picked up too, just from the conversation, is just ask the question,
Yeah.
Yeah,
right?
exactly.
We're not asking the question. Like Jenna said, like this is, I don't know, we're in the late 80s in the number of episodes we've done, and this is the first time we're addressing this too. And it's a much bigger problem than we've
Yeah.
recognized or that we can
Yeah.
see out there. So like we need
Yeah.
to start asking that question.
Yeah, well, it's hidden, right? So, like, I
Yeah.
always train people when either train a psychiatrist residents or psychologists, right? I said, if I went on a 5-day, binge on cocaine or alcohol, and you saw me, be like, you look rough, you don't look good. I could go to the casino down the street and lose $50,000 in 10 minutes, and I
Yeah.
might be
Yep.
dying inside, but I still look like Shane.
Right.
And that's the issue, is that it's hidden. And so it's really
Yeah.
on you to create that space. And but the thing is asking people how they spend their money, or if they're having financial issues. You go, hey, I noticed that you're having some challenges, paying some bills. What's going on? And just that curiosity, and just, I also do things like, when I'll say, well, I work a lot with people who have these issues, and I describe, gambling problems. I say, I wonder if that sounds familiar to you, or something you're concerned
Yeah.
about.
Yep.
So,
Yep.
because if you acknowledge it's a real issue for others, well, then we're more
Yes.
likely for someone to say, that's my issue too. And they don't feel like they're the only person. Because I tell people all the time, you're not, like, with our veterans, you're not the issue. You're not special. This is a big issue. Just like I do a lot of work on pornography and high risk sexual behavior. Well, that's a big issue in our veterans, because they're using often sex to cope and engaging in high risk behaviors because of the trauma. And our goal is to get them to treat the trauma, right? Not do the high risk behavior, right? Um, and we've done that research, but also getting them to get help is also challenging, right? And that's our challenge, right, as providers.
And of course, we'll list all of those in the show notes for
Yeah.
Yeah,
everybody,
That's
all those resources that
yeah,
Shane mentioned. And so those will be
many
available in the
ways
notes for you to check out.
yeah,
for sure. And spoiler alert, that's what I want to follow up on is
yeah.
work that you've done on pornography addiction. And
Yeah,
so
yeah.
maybe we'll be
Sounds
lucky
good.
enough to have you back. Maybe we'll get you to do a webinar, but we
Sounds good.
absolutely appreciate
Thank you so
your
much.
time with
Thank
us
you.
today, but also just your time with this topic and your dedication to the military connected population, especially for us.
Yeah.
And thank you so much for coming on today.
Thank you so much for having me.
And thank you, everybody, for listening. We appreciate you joining us each time, and we're looking forward to your reactions, your comments. Please feel free to leave us an email message. We'll put our email address in the show notes, or you can leave us a voicemail message on our SpeakPipe. We'll leave that link in our show notes as well. But we're always interested in hearing the impact, the questions that you have, and we want to hear your moment that changed you, your impactful moment. So send us a message on that as well.
And until next time,
stay curious
and mind your EBPs. See
Bye,
ya.
everybody.
Bye.
Be sure to subscribe to Practical for Your Practice to be notified when new episodes arrive. Our theme music is Failed Attempts by Nitro, and our administrative assistant is Bree Mercer. This podcast is produced by CDP at the Uniformed Services University of the Health Sciences. The views expressed are those of the speakers and do not necessarily reflect the opinions of the Uniformed Services University, the Department of War, or the U.S. government. In addition, references to any specific companies, products, processes, or services does not necessarily constitute or imply endorsement by the Uniformed Services University, the Department of War, or the U.S. government.